In the wake of the type 2 diabetes trials proving the benefits of the SGLT2 inhibitors, both on atherosclerotic cardiovascular disease outcomes, but importantly on the heart failure outcomes, the field raced quickly to get into a broader space testing these drugs in heart failure per se. And as has been presented now, the DAPA heart failure trial was the first of these trials that have been presented. There's a similar trial ongoing with empagliflozin, where these trials have enrolled patients with reduced ejection fraction heart failure independent of their diabetes status. And a great stroke of luck in DAPA heart failure, it was roughly 50-50 split. So about half the patients had diabetes and about half the patients did not have diabetes. Everybody entering the trial had a reduced ejection fraction heart failure, and they were randomized on top of outstanding evidence-based heart failure therapies to receive dapagliflozin versus placebo. And it was a remarkable superiority benefit, both overall for cardiovascular death and hospitalization for heart failure or acute presentation with heart failure complications, which was the primary outcome. And there was no difference whether the patients had or did not have diabetes. And so this is a landmark revolutionary trial in the heart failure space, specifically heart failure with reduced ejection fraction, that this now adds to the level 1A indicated therapies like ACE inhibitors, ARBs, ARNIs, beta blockers, mineralocorticoid antagonists. We now have a brand new class with robust evidence suggesting incremental benefit added to the very best available therapy up to that time. So yes, this is a landmark practice changing, and my colleagues are already embracing this and using SGLT2 inhibitors routinely. Now, I am going to be thrilled if we get a second trial confirming the effects that this is a class effect. Right now, all we know is that dapagliflozin has this benefit. I look very keenly to the results from the EMPA heart failure trial with the reduced ejection fraction to confirm and support that this may be a class effect, and the use of all of these agents may benefit such patients.